From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Face and neck lifts are some of the most well-known cosmetic surgeries out there, and for good reason. They can do amazing things to help refresh your look, enhance and contour your features, and boost your confidence. And there's no one better to guide us through both lift procedures than Dr. Yula Indeyeva. She's a double board-certified facial plastic and reconstructive surgeon, fellowship-trained in face and neck lifts, and the founder of Facial Plastic Surgery of Austin in Austin, Texas. Her specialty, helping enhance her patients' confidence, happiness, and quality of life through facial rejuvenation surgeries. So whether you're noticing early signs of aging or simply want to know more about face and neck lifts, this episode is for you. Dr. Indeyeva, welcome to the Care Experts podcast.
Thank you so much. It's so lovely being here.
I'm so excited to talk to you about this today. I have so many questions, but I'm very curious to start off with, you're known as being one of the best plastic surgeons in the nation. What inspired you to get into this work?
Thank you so much for your kind words. You know, I think the face has always had this sort of a mystic appeal to me, even from a young age. I've always loved photography, specifically portrait photography. And I did a lot of that in high school and college. And when it came time for medical school, it just happened for me naturally that I kind of eliminated all other paths, career paths, and ended up pursuing facial surgery. I mean, the face just has, such evolutionary, such social significance that I've always wanted to be a part of that.
Oh, I love that. What's your favorite part about your job now?
I love joining people on their journey. What I find a lot is my patients, and I specialize in the aging face. I should probably start by delineating that. But a lot of my patients come in with a very common theme. Nobody ever feels the age that they are.
Right.
So it's so rewarding and so fulfilling for me to allow people to do things to allow them to harmonize the way that they feel on the inside and bring that age that they feel that they are closer to what they appear.
So they're coming in and they're saying to you, like, I'm 50, 60, 70.
Correct.
But I feel so much younger, or I don't feel as tired as I look.
Correct.
Can you help me with that? And
Yes.
getting them to that place would be so gratifying.
So gratifying. And, they just say, I just don't feel like, looking back at my mom at this age, I don't feel that I'm her. I feel like I'm so much more active. I feel like I have a social life. And of course, with the workforce and our lifespans increasing year after year, it makes sense that people want to retain their youthful appearance for so many social and career benefits as well.
I feel like I'm hearing so much about women in their 50s and 60s getting facelifts or neck lifts now, whereas when I was growing up, it definitely seemed reserved for a very specific group of the population, like celebrities, who were much older, and it was really obvious when they did it. Are you noticing that in your practice as well?
Absolutely. So I would say even in the last 5 years, my practice has seen such a significant transformation of the typical aging face patient, average age about mid-60s to now early to mid-40s.
Really?
Yes. And I think this is just stemming from the fact that there's a lot more awareness, with social media and the internet, that people realize they don't have to look like their grandma's facelift.
Yes.
They see facial rejuvenation as more of a self-care method, and they want to take advantage of that.
What would you say is the most common question you get from somebody who comes in on that first visit?
It's, will I still look like myself?
Right.
So that's this kind of paradigm of they don't want to look too different.
Yes.
But they want to look meaningfully different, but they still want to retain their inherent characteristics that make them who they are.
Right. The best work is work that you're questioning whether it's being done or not,
Correct.
right?
Yes.
Yeah.
Correct.
And we're seeing so many celebrities, athletes, speakers, performers who you really can't tell. Like it's not the same as what it used to be at this point.
Correct.
Let's talk a little bit about facelifts to start off with. What is a facelift?
Well, a facelift is a surgical procedure designed to restore a more youthful position of the facial tissues that get lax and descend with age. So typically soft tissues, we always talk about the SMAS, which is really a conglomeration of fat pads, facial expression muscles that are all kind of engulfed in this connective sheath. I tell patients I think of it as kind of like a spider web of this fibrous connective sheath network that suspends groups of facial muscles and fat pads that descend with age due to, a multitude of factors we could spend, hours talking about, but that's the general idea with the facelift is releasing them from their anchored position and setting them back to their more youthful position.
So you're taking this sheath and essentially pulling it up, working against gravity in the other direction.
Correct.
You mentioned there's fat pads in the muscle, obviously. Are you carefully moving those things too, or does everything just sort of move with the sheath?
So the sheath envelops those structures. So they typically move as a unit together.
All right.
Yes.
Now, are there different types of facelifts? I've heard about people having almost like a lower facelift and then their eyebrows lifted. Or can you break down a little bit like the different types?
Yes. In my practice, a facelift encompasses all relevant units of the face that undergo these gravitational changes. So for example, my facelifts include the neck, the face, and the upper face, meaning not eyelids, but the facial tissues that descend with the scalp. So temporal lift, forehead, all of these facial regions age as a unit. So to me, restoring all interconnected units leads to the most natural and long-lasting appearance. There are some surgeons, actually quite a bit, that will refer to facelifts as a lower facelift and then with an option to add on an upper face rejuvenation or a mini facelift.
Almost like I'm not doing as much if I just do the lower part.
Correct.
But what's the risk with just doing a portion of your face?
I think stigmata of surgery becoming very apparent. So for example, if we're moving, if a face has descended down as a unit and we're only addressing this part, I don't know if you can tell, but there's some bunching that happens in the temporal area. So I would never leave a patient with bunching. And if you don't move the face to the degree of causing this bunching, to me, that's typically an insufficient lift, which doesn't move the mid face enough. So for me, I have to address the bunching by coming up and releasing some of this as well. So, but a lot of people don't like the idea of that. They're scared of a brow lift, deer in the headlights look. So it takes quite a bit of education on my part. And this is probably why my consults last at least an hour to usually an hour and a half with my patients, because I have to explain all this to them, but we don't use these terms like mini facelift, lower facelift. It's just a facelift that's going to incorporate all relevant portions of your face to make you look the most rejuvenated and the most natural.
What would you say has changed from a technological standpoint in regards to how they're doing facelifts or how you're doing facelifts now versus 20 years ago?
Yes. I think the techniques, there's been a lot of progress in the facelift techniques, and there's some amazing giants in our field that have really paved the way forward. So the big distinction currently that most patients recognize is the SMAS facelift versus the deep plane facelift. The deep plane facelift is kind of the hot topic, kind of the hot keyword right now. It's definitely not a new concept. I mean, it's been introduced into the surgical repertoire since the 80s, but the technique has evolved. So what a deep plane facelift, the biggest difference between that and the SMAS facelift and by SMAS, I'm referring to, it's an acronym for superficial musculoaponeurotic system. So
Okay,
SMAS
SMAS.
definitely rolls off the tongue a little easier. But this is that connective network sheath with the enveloped fat pads and facial muscles. It's the degree of manipulation of the SMAS. That's the main difference between the two techniques. With a SMAS facelift, you're not fully releasing that from the anchoring points,
Okay.
which are ligaments.
Yep.
With a deep plane technique, you are accessing that strength layer of the facelift much closer in the face, physically closer to the goals that you're trying to rejuvenate, like jowls. Like you're going closer, you're entering that plane closer versus further.
Right.
You're also performing a complete release of all the tethering points. And that allows the face to move freely and naturally. It basically tells you where it wants to go, honestly, without
interesting.
tension.
Because as you pull up, then everything's moving together, as you mentioned, because of the
Correct.
sheath.
Correct.
So this is what you perform?
Yes. Yes.
Okay.
So I think that's, and again, I could probably talk on this topic for hours, but this is the main differentiating points is the complete release in a deep plane facelift. And now with some really talented surgeons introducing even a newer concept of a preservation deep plane facelift, which limits the amount of skin we elevate in order to access that deep plane flap.
Okay.
So limiting skin dissection means less opportunity for bruising, swelling, any little speed bumps in recovery.
How does a neck lift differ from a facelift?
A neck lift, first of all, addresses a different area of the head and neck, so the neck. There are some obviously major anatomical differences in the two areas. And a neck lift also involves some degree of not just muscle tightening or lifting, but in many patients, we include some debulking.
Oh.
And of course, not in everyone, but some patients have this kind of genetic predisposition or just lifestyle predisposition to kind of harboring deep fat pads and bulk that looks unfavorable on their body or kind of is discongruent with the rest of their body. For example, think a really petite person with a really wide full neck.
Right.
That doesn't necessarily correlate with the rest of their body. So with the neck lift, there are some extra things we do in the midline, in the deep neck space. That includes sculpting of deep fat pads, salivary glands, trimming, and sometimes kind of very subtly resetting the way that certain muscles in the deep neck attach to certain structures to create a more favorable angle and a more favorable contour under the jawline.
Now, if somebody's considering having this procedure or one of these procedures, how long should they expect to be in recovery? And what does that period look like?
Yeah, I break the recovery down into different stages. So I tell them for 2 weeks, this is a non-negotiable. You're going to hunker down. You're going to release yourself from any social or work commitments. You are going to give your mind and body time to heal. And this is just the initial healing period. So this is the period where certain things that we take for granted in our daily lives can cause irreparable damages to what the surgery aimed and what it carried out.
Such as?
So we do a lot of muscle manipulation, remember, in the neck especially.
Yes.
And the muscles, this specific muscle I'm thinking about right off the bat is the platysma muscle, which is a thin sheet-like muscle that starts at the collarbone and it comes up the neck like a thin sheet. We trim that muscle, we tighten that muscle, we manipulate it into to give us a certain shape. And we do all this with strategic cuts in the muscle, trimming, and sutures. Now, that muscle is not like a big bulky bicep or a quad muscle. It's a sheet-like muscle. So undue tension, increase, like a rapid increase in swelling, blood pressure can cause that muscle to pull out of sutures, basically, and lose its shape, the shape that we bent to our will, basically. So that's kind of right off the bat, the most concerning thing that someone can do is overdo their physical activity, overperform certain movements like turning or straining the neck. And this is what the biggest caution that we give to patients in their first 2 weeks of recovery.
Okay, so that first portion, we are truly resting.
Absolutely.
And then how does recovery continue?
So then we start giving them a graduated release to their normal life. Okay. So, the 2, 4, 8 week rule. So the 2 week we already talked about, and I call that princess mode. Most people, they like princess mode.
Just lean into it.
Yes. Then our next stage for me, and every surgeon's different, but at 4 weeks, I allow them to start getting their heart rate up. And I don't mean like push yourself. Like this is not a an orthopedic surgery where you want to start working that joint soon after surgery to retain mobility. This is, if you want to take a leisurely stroll around the neighborhood, you can start doing that at 4 weeks to the point where your heart rate is up from your baseline.
Okay.
But not before 4 weeks. And then the next stage comes at 8 weeks where they're allowed to do movements that engage the neck. Really anything that engages the core, yoga, bar, lifting anything heavier than 10 pounds.
Yes.
Basically any activity that they were able to do prior to their surgery, they can resume at 8 weeks with, of course, caution,
a lot of caution,
and gradual approach. I always say things like, golf, tennis, where the head and the neck kind of go in opposite directions a lot. These are big no-nos before 8 weeks. And at 8 weeks, they're basically free to go.
Oh, wow. Okay. Yeah. So 8 weeks, we are back to living life. And bruising, swelling, how long does that generally take to start to dissipate?
Yeah, after 2 weeks, I would say about 80% of bruising and swelling is gone. And then it tapers off. So you're not seeing as quick of a resolution as you did in the first 2 weeks. So that actually by 8 weeks, about 90% of swelling is gone. Bruising is typically 2 to 3 weeks is gone. Now, the important part is that last 10%, and I always tell people this, that last 10 pesky percent of swelling is going to ebb and flow for the next year, really.
Okay.
So that you'll always notice you'll always feel like you're a little bit puffy.
Right.
Some days worse than others, some areas of the face worse than others.
Yes.
And I always say with surgery, we kind of prime you for swelling. That's how the body is able to heal and bring in, the healing cells and new blood flow. And that doesn't just go away.
Right.
So typically things that like before surgery, things that would make you more puffy, let's say margaritas and chips and salsa, are definitely going to make you way more after you've had surgery. And you'll notice normal, that. Very normal. No one else should notice it, but we know ourselves very intimately, so we will always notice that.
Yes. Okay. Now, after somebody has gone through this procedure, what are you hearing in your follow-up sessions with them? Are people generally happy with the results? Is it a bit of a process getting comfortable with the new face? Yes,
most people are very happy. I mean, I've had some really heartwarming stories. I've had one very sweet woman that went onto a weight loss journey and then kind of rewarded herself with the facial rejuvenation. And she shared with me after her recovery, again, she kind of felt that her outside harmonized and just synced with her inside. And that made such a positive impact on her mental well-being and her motivation in life in general, that she was retired at the time. She was 65. And she said, my husband and I just fell into this rut. We were retired. We would just sit home all day, watch TV, eat. And then after I did this, I felt like I did, 20, 30 years ago. So they actually sold their home and went on they bought an RV with a trailer, and they just went cross country to see all the things they've wanted to see. Wow. And that was very touching for me. And that's one of the things that sticks in my mind. A lot of people get a renewed sense of professional inspiration. So they're applying to jobs that they thought they wouldn't be competitive for. They just feel like they they want to radiate the energy that they gain from feeling and looking their best
Yes.
out into the world.
Yeah.
And
I get that.
it just spreads to everyone around them. So.
I'm really curious, before we go on to our Ask Me Anything questions from our audience, many people, before even considering having a neck or facelift, are trying things like fillers or Botox. Can these things impact your ability to do a neck lift or a facelift later on down the line?
In the context of injectables, the type of injectable and the location can certainly have an impact. I know, Sculptra or polylactic acid has been kind of a debated topic in our field, and this is basically an injectable product that stimulates collagen formation. But collagen is fibrosis, to some extent, and when fibrosis happens in a plane like the deep plane where tissues should just spread easily apart, they can become sticky, and they can certainly cause technical difficulties for the surgeon, recovery-wise for the patient. So I would say in my practice, and I do quite a bit of injectables as well. I do my own injectables. So it's really never an issue in my patients, but certainly have seen people where it was put in the wrong plane. It was maybe overdone to where there's just an overabundance of volume, where it limits our dissection, it limits our vector of repositioning. So absolutely can be harmful, but it doesn't have to be. So I don't like to generalize. Injectables are not evil. They just have to be done tastefully and appropriately.
Okay, amazing. Let's dive into some questions from our audience. I'm only 45 and feel my face is aging quickly. Am I too young for a facelift, and/or are there any alternatives?
Definitely not too young. I have definitely performed facelifts on patients younger. I do have two requirements. Age is not one of them. Are there physical exam findings that justify having surgery? Meaning, is there meaningful impact we can achieve with surgery that would be worth the downtime, the investment that the patient would have to make? So that's my number one requirement. Number two requirement is obviously health status. So we have certain requirements for BMI, certain chronic diseases, have to be well managed. So health status is number two. And I should say, I do have three, not two. Three is the patient's mental capacity to accept undergoing surgery and be able to make that commitment. So I think if all three of these are met, it's certainly not too early.
Okay. Can you combine a face and neck lift with other procedures like eyelid surgery or skin resurfacing? I'd rather do everything at once if I can.
Yes, and I would say in my practice, that's the majority of our patients. They address the face holistically. So facelift, neck lift, some degree of temporal lift or a brow lift always coexist together. Many patients add adjunct procedures like upper blepharoplasty, lower blepharoplasty, lip lifts, chin implants, fat transfer. I actually include in every facelift as well, because most people can benefit from a very elegant approach to fat transfer as well.
And that is where you're taking fat cells from another part of the body through liposuction?
Yes, micro liposuction.
Like a small cannula, and then inserting it into the cheek pads or areas of the face that could use a little extra volume.
Correct. The other way that fat transfer can be used is not for volume, but for skin rejuvenation. And this is where we process fat in a certain way to basically remove cellular components and only leave behind growth factors, cytokines, stem cells that the skin and our tissues just love for rejuvenation. It's like a drink of youth for our skin. So some patients may not necessarily need volume. And I actually don't heavily rely on fat transfer for volume. But for skin rejuvenation, it's a beautiful way to kind of give your own body its own fountain of youth and really cause a nice improvement in the skin.
Beautiful.
Yes.
I've seen a lot of people on social media talking about Botox for neck bands lately. I'm in my early 50s and starting to notice loose skin around my neck and jawline. How do you know when something like Botox might help and when it's time to think about a neck lift instead?
Yes, so Botox addresses a very limited function. It addresses muscle activity. So there are some patients or some people are really prone to flexing this platysmal muscle like I'm doing now. And actually, the more it flexes, the more it kind of stretches, the more it pulls on the skin. So in those patients that have a really active platysmal muscle, and usually at the earlier stages of aging, we can inject a little neuromodulator to relax that muscle and kind of decrease that pull and the effect it has on the skin and kind of that banded appearance. However, as this progresses, it's not so much the muscle activity. It becomes the platysmal bands become more apparent just because of the laxity.
Okay.
And they don't significantly change too much with the activation of this muscle. They just kind of hang. Extra skin is also not addressed by Botox. So I think in the earlier stages, it can help to kind of flatten and smooth things. But as we progress, they're going to be pretty limited in addressing the heaviness and the laxity that happens.
Okay, so helpful.
Yes.
This has been so informative. Thank
Good.
you so much for joining us on the podcast
My
today.
pleasure. Thank you for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.